So today I'm with Dr. Gavin Macgregor-Skinner, who is now with ISSA and the GBAC team full time. And Gavin, let's talk about something that you are seeing out there in your work. One thing I know, every time I try to track you down, you're in a nursing home, or maybe 2 or 3 a day, or a hospital. What are you doing in those environments?
I'm focusing on just-in-time training, Jeff. And what I mean by that is the necessary skills, competencies of using personal protection equipment. There's so many of the frontline workers, whether they be providing direct patient care, looking after residents, but even the cleaning staff, the house cleaning staff, also the kitchen staff, the laundry staff, the maintenance staff. Many of those people have never put on personal protective equipment in their life. They're now working in an environment where we have an unknown disease status or viral load status, and we need to protect all the frontline workers. And again, that's not just the nurses and the doctors. This is all the other staff that make a nursing home, assisted living, a veterans home, for example, or even a hospital work on a day-to-day basis. So it's about training skills, competencies, about ensuring that they use the appropriate disinfectant, read the label, ensure you know what the safety data sheet looks like, but also ensure that you can kill this virus, which we know causes COVID-19.
Very good. There's some interesting information out there online about solutions to kill the virus. We see talk about ozone, we see talk about products, chemistry. What about UV light? That seems to be a big topic today. What do you have to say on that? Is that an option for us?
There's lots of options, Jeff, and so UV light, or it's actually UVC light. There's been lots of research done, lots of papers that have been published. What's unfortunate is that the frontline house cleaning staff don't have access to all this wonderful research. And so the research is done through peer-reviewed journals. It's presented at a conference where the average house cleaner never goes to a conference like this. They can't take time off. That's not what they do. And so they don't get the great scientific and evidence-based information that you and I have access to. So again, through the Global Biorisk Advisory Council, or GBAC, we're trying to bridge that gap. How do we take the science down to the front lines? How do we work with people? Like, again, with UVC light, a lot of people said, if I switch the light on, I know it's going to work. How? Because that peer-reviewed journal, that scientific journal article told us so. Well, that's not how it works. You need an indicator. You need a chemical indicator, a biological indicator. You need to show the people that are highest at risk, working on the front lines, that you've implemented an evidence-based approach, say, like you using UVC light, which we know works, but you're doing it in the real-world setting and you're killing the virus. And that's the big gap that I hope that GBAC will focus on and partner with many of these companies that make UVC lights and other technologies to do the evidence-based research and approaches.
And I believe you mentioned previously that the airport in Boston is doing some of this testing.
Yes, it is. And so, again, this started from an article I read about Heathrow Airport. And Heathrow Airport had started using UVC light. And so I thought, oh, I'm going through Boston now. I was working in Massachusetts last week, and also Connecticut and Rhode Island and New Hampshire, working at hospitals and nursing homes. And I came home on the weekend back to Washington, D.C., because I had to be home for Mother's Day. So I came home for Mother's Day. And as I was coming through the Boston airport, I asked some questions. Is anyone here know anything about UV light? And they said, oh, yes, we're doing some research over here. Would you like to see it? So I went over and they've got something actually set up. And I went, this is fantastic. So they're actually taking the UVC light that we know works in the lab and has worked in many other situations, like disinfecting hard porous surfaces like keyboards, for example, in nursing stations in hospitals. Seeing how it may work, it could be implemented, operationalized in an airport setting. And I think this is really exciting. If we get some positive results out of this is going to be a game changer.
Yeah, I hope that happens. Any tool we can get that's effective has its place. You had an experience recently. We think about being safe and protecting ourselves and protecting others. You went through a TSA checkpoint, and the response you got from the TSA folks wasn't exactly what you expected. Tell us about that.
You're right, Jeff. And again, I understand the parallels between security and safety. And I understand that we were talking to the whole US community, the 330 million people, we're telling right now, maintain physical distance to prevent spread of this SARS-CoV-2 virus. As I was going through TSA, there were these groups of TSA officers all standing, because there's no one at the airport. The airports are empty. There was like 7 people on my flight the other day. But the groups of TSA people are all standing around in groups of 4, 5, and 6. And I went, oh, that's not good infection prevention control. And then I came through the scanner, like you always do, and the TSA officer said, I'm going to pat you down. And I said to him, no, you're not. And he said, yes, I am. And I said, I work in a hospital. I've just seen 23 COVID-19 patients. They're very sick, and I was there last night. And he said, I'll call my supervisor. And the supervisor came in and said, we're going to pat you down. I said, no, you're not. What's the problem? You have something in your pocket. And I said, let me open. And so having this dialogue, this conversation, when they have a job to do, and I get it. They have to focus on security. What I'm trying to do is explain to them that why we have this new coronavirus disease, COVID-19, circulating, we don't know where it is. We can't see it. It's an unseen enemy. And I was trying to say, I'm caring about you. I care about your safety. If there's any chance that I may still have virus on me after working in the hospital, I don't want you to get infected. And that was a big gap, a big misunderstanding. And so I managed to get through safely through security and get onto the plane and come home to Washington, D.C. But again, this is an area we have to think about. How do we do security at airports with no touch technology? And we're not there yet.
Yeah, it's interesting. And if someone came up to me and said, I just was around 23 positive patients, I'd be, not going to pat you down. So
they really wanted to pat me down. That was a good discussion.
Maybe you're a scary looking guy. I don't know. Well, listen, in Ohio, where I live, they're opening up restaurants. Today is May 14th. They're opening up restaurants for patio seating tomorrow on the 15th. And next week is full dining. What do you think about states opening up? I know up in Wisconsin, I think they're fully open and the bars and restaurants are crowded. What words of advice do you have for people on that?
I think from what I've learned, Jeff, I've been working with hotels, restaurants, salons, spas, gymnasiums recently. We can do this. We can open up, but it's understanding and defining what does that new normal look like? What toolkits do you need in your toolbox to clean and disinfect and kill a virus in a gym, for example, or in a hotel at the reception desk? What physical barriers can you put up, like a perspex or a plastic shield that protects droplets from affecting the person who's trying to check you into the hotel? Could we actually rope off the area in the hotel and keep everyone 6 feet back from the reception desk? Do I still have to take that credit card out of your hand and scan it, or do we have no touch technology that we use? The same work that I'm doing in restaurants now. You can still go to a restaurant, but I need to ensure that the server, the kitchen staff, whoever takes your credit card to pay the bill, as well as the location of the tables, is done in a way that we have physical separation and that we ensure we follow good infection prevention control measures. Again, it's a challenge. It's a new paradigm. But I'm seeing supermarkets like Target, Walmart, and other supermarkets actually change. I was in a Walgreens the other day, and again, the way that they had rolled out and said, this is how, and they actually had people there supervising, saying, you're too close, separate. I went, guys, this is awesome. And they actually managed the movement of people. They had arrows that went down one of the aisles and arrows that came up the other side of the aisle. So they managed movement of people. So we didn't actually come in face to face. We didn't bump into each other. That's what the new normal is looking like. It's doable, but it takes training. It'll take some supervision. It'll take management, and it'll take a paradigm shift in making this work. But it can be done.
Well, I hope that paradigm does shift, because we all want to get out and be social again and enjoy life, but we have to be careful and safe as well. Well, Gavin, appreciate your time, and continue doing what you're doing out there.
Oh, I totally agree, Jeff. I've been stuck in my basement now for a couple of months, and it's time to get out.
All right, we'll escape sometime.